Having an abnormal or dysfunctional heart could be a restriction in daily life. Nevertheless, millions of patients around the globe are requiring regular checkups. Some of those diseases are already present at birth or develop during life, such as pulmonary hypertension. Routine methods for diagnosis and monitoring are imaging techniques such as CT scans, MRI scans, or invasive cath lab examinations. CT scans and cath lab examinations usually involve radiation exposure and contrast media injection. Imagine you could combine a diagnostic cath lab procedure with an MRI scan. You would see the heart directly without contrast media, and your patient would not be exposed to ionizing radiation. This could be a win-win for both patient and diagnosing cardiologist. Major success factors to enable such a win-win include dedicated MRI-suitable instruments and enthusiastic, open-minded practitioners. Nano4Imaging has developed the first MRI conditional guidewire, which got CE and FDA clearance to support MRI-guided catheterization. The following video illustrates how such a catheterization can be performed with an MRI. Visible but safe wire using passive MRI markers. The 3 markers on the tip of the guide wire are used to navigate the wire to and in the heart, along with a pressure catheter to the right ventricle and into the pulmonary artery. Then the balloon of the catheter is inflated to position the catheter firmly at the desired location. The MRI can add the flow data to the measured blood pressure to allow accurate resistance calculations. No more assumptions are necessary. MR delivers gold standard flow and volume data. The real-life sample MRI sequence shows how a conventional catheterization is done into the left pulmonary artery by guiding the guide wire towards the heart after several deflections into the hepatic vasculature. The procedural setup requires MRI conditional monitors being present for the examination. Such monitors are meanwhile available from various suppliers. The process therefore needs investment into equipment which is dedicated to be used under MRI conditions. Professor Ewert from the German Heart Center in Munich has invested considerable time and effort in enabling this procedure. He quotes, "Performing a one-stop shop hemodynamic session in CMR saves cath lab time and resources." Diagnostics under MRI guidance are therefore a sustainable approach offering competitive advantages by measuring blood flow and related volumes simultaneously. Exposure to radiation and contrast agents can be avoided, and especially children and pregnant women can be examined with less burden. Pioneering clinicians in the USA, UK, and in Germany already paved the way and demonstrated successfully the win-win that can be achieved when using the MRI suite as the cath lab. Our guidewire is a first important step towards a medical device toolbox to transform the MRI suite into tomorrow's cath lab, to avoid radiation, and to benefit from the outstanding diagnostic features that MRI has to offer.